Sawadee Krap. Good morning from Bangkok. My name is Thitinan Pongsudhirak. I'm the director of the Institute of Security and International Studies at the Faculty of Political Science, Chulalongkorn University. I want to say good morning and hello to everyone, sawadee to everyone, because this is our fourth webcast, number 4. The first we had on ASEAN and COVID-19, the ASEAN regional response or lack thereof. Second one we had on Southeast Asia, comparative responses from Southeast Asian governments with the different regime types to COVID-19. And the third, last week we had something on the Thai economy post-COVID, what we're looking at. This week, for our fourth webcast, we are turning towards the balance and priorities between COVID-19, the virus risks and concerns, and on the other hand, economic imperatives. Just to tell you, I think after 1 month, more than a month in Bangkok of lockdown and curfew and all these disruptions and adjustments, what we're seeing, I think, is a very fluid situation. Even for me, for us working as academics, as students, the first couple of weeks of online learning teaching was exciting because it requires some adjustment and some learning, reskilling, upskilling. But I think by the end of April, by the end of the month, I think the sentiment is shifting a little bit. I think many people are more anxious, maybe bored a bit, and want to resume some normality. So there's an ongoing, moving balance between handling, managing, containing, and putting the virus under control, this coronavirus, but at the same time having a normal life and livelihood, jobs and activities that we would normally do. So that's a kind of the rough balance we want to discuss today. And it's not just for Thailand, it's also global, the international community. Many countries are partially reopening this week. Today is Labor Day. Happy Labor Day to all of us and to many laborers in particular. But Labor Day is just another working day in many ways. So I want to proceed by thanking first and foremost our two speakers, Dr. Daniel Kertesz, Dr. Kirida Bhaopichitr, for joining us today. Just because we're online, they're still very busy with their online work. I also want to welcome all the viewers who are joining us live and the viewers subsequently who will tune in. We've had some very good turnouts over the last couple of webcasts. Over 1,000, 1,200 have tuned in subsequently. Along the way, midway through, we'll be taking questions and comments as usual. Please write them into the Messenger, ISIS Facebook, and our team will fill them and pass them on. We also, this time, for the fourth webcast, for the first time, we have a YouTube availability too. And I think you're supposed to have some YouTube link, so you can also watch us and listen to us on YouTube as well. Now to the speakers, normally in person, I've concluded after 6 weeks of this online processes of learning, communicating and teaching that the in-person public forum that we normally do is simply irreplaceable, and online can be complementary but not substitutable. But nevertheless, since we're not in person, I have to tell you a little bit about the background. You don't have the resumes and CVs of the speakers with you. So I'll just say, just very briefly, that Dr. Kertesz, Dr. Daniel Kertesz, the Thailand representative of the World Health Organization, comes from a very accomplished, established, illustrious background. He's worked in many places in Africa. He also has some experience handling the Ebola response activities in Sierra Leone in 2014, 2015. Dr. Kertesz is a medical doctor. Prior to joining WHO, he was the chief of the Division of Respiratory Diseases at Health Canada. So he's Canadian, Dr. Kertesz is a medical doctor specializing in internal medicine and infectious diseases, holds a degree, master's degree in epidemiology from the London School of Hygiene and Tropical Medicine, and is a fellow of the Royal College of Physicians and Surgeons of Canada. So that's his background roughly. And I think if you receive our email, you also will have the background in PDF. Our second speaker, Dr. Kirida, is the Research Director for International Research and Advisory Service at the Thailand Development Research Institute, a big think tank that we have in Thailand. Her work spans monitoring, analyzing developments of the global and Thai economies. Dr. Kirida leads the TDRI Economic Intelligence Service, which prepares monthly seminars for corporate members on issues of high relevance and interest for business. She also was a senior economist in macroeconomics and fiscal policy management and country economist for Thailand at the World Bank Group before that. And she has a PhD in economics from Cornell University. Okay, so those are our two speakers, and also the viewers can also have comments, remarks, and questions. I would first start with a couple of charts, if I may ask our tech team to show a very indicative chart. Basically, this is a testing charts. So you can see from these two charts, basically, Thailand's testing of coronavirus is rising, but still very low. The second chart, you can see the other chart, please, the tech team. You can see the highest, well, the most conspicuous, salient trajectory is Malaysia. Malaysia has a lot of testing. So basically, what we are looking at, Thailand's COVID handling has been so far effective. The numbers have dwindled from 3 digits to 2 digits. Infections now down to 1 digit over the last few days. At the same time, recoveries as compared to infections have been almost on par. It's approaching, basically almost everyone has recovered except for about a little bit over 200. At the same time, the death toll, 50 plus, considered pretty low by international standards. If you look at the coronavirus tracker, you can see Thailand's number 50-something, 56, 57. The United States is number 1 in terms of infections and in terms of the death toll. So Thailand, in a way, over the past month of forced social distancing, lockdown, very stringent and tough measures. And it's not the only country that has been doing that, a lot of other countries. But for Thailand, it has been working. And this means that, some people are looking for a new balance, a moving balance, maybe towards 1 month ago, we were more concerned about the virus, its potency, its lethality. But now maybe we're more concerned about economic well-being and where to draw that balance. Some people are saying that, I think a lot of doctors will say that we cannot be complacent. We cannot relax too soon because the virus still has a long way to run, a long course to go, and it could come back in another wave, second wave, third wave. If you look at the Spanish flu 2 years ago, it actually went in several waves, and the second wave was the deadliest second wave. So, some people are concerned that maybe if we relax too soon, ease off too early, we could end up with another wave. So we don't know about the virus. We don't know about the vaccine, how far away from the vaccine we are. So let me just talk to a doctor on our show, Dr. Daniel Kertesz. Please, maybe you can give us a little bit about the virus, itself. We don't know enough. There's too many unknowns about the virus, but there are also enough knowns. What we do know is that we also want to resume some normality. Where do we draw the balance? How bad can the virus get? Maybe you can talk a little bit about Thailand in a regional context. We have very low numbers in the Philippines, Indonesia rising but still low. And, in a regional context, I'm thinking that it either will get a lot worse or maybe it will just blow over. Maybe the virus is afraid of our humidity and heat. What do you think, Dr. Kertesz?
Well, first of all, thank you so much. Can everybody hear me okay? I hope so.
Can hear you.
Dr. Thitinan, thank you so much for inviting me here today. It's a real pleasure to be with you and your viewers. I know it's a real challenge to do these things, and I really appreciate the tenacity that you and the Institute have shown in hold these online fora. It is really challenging, but we're all learning a lot of things, and we're learning how to communicate our messages through these type of fora, which I think is really important. And I just want to say happy 1st of May to all your viewers. I'm calling in from my office at the Ministry of Public Health. I run an office of about 30 people here. I'm the director of the World Health Organization, the representative of the World Health Organization here in Thailand. And we're embedded here on the 4th floor of the Permanent Secretary's office of the Ministry of Health. So maybe I can just say a few words, maybe underlying some important concepts that might frame our discussion going forward. As most of you know, we're now 121 days since the first notification of COVID in Wuhan. I think we've all been shocked at how affected the world has been in just 3 months. We've seen now over 3 million cases. In Thailand, the first case was notified on the 13th of January, and since then there's been almost 3,000 cases and 54 deaths recorded. And although Thailand was the first country outside China to report a case, we just haven't seen or experienced the kind of explosive outbreaks that have affected many of our neighbors in Asia and around the world. For many weeks now, we've been seeing the number of reported cases leveling off, even decreasing. Fortunately, we just haven't seen a sustained steep rise in confirmed cases, really anywhere in the country. So I think many of us are cautiously optimistic, but I underline that adverb cautiously. It is really important to remember the big lesson that this virus has taught us over the past 3 months in places like China, Italy, Spain, Iran, the United States. And that lesson is really that cases can increase from a few scattered individuals to hundreds, even thousands in a few short days or weeks. Even now, Singapore and Japan, which were countries that were thought to have controlled the virus, we're seeing steep rises in case numbers. So we always need to remember that this virus has explosive potential to quickly overwhelm even the best health systems and cause disease and death anytime and anywhere. And I think this really gets to the principal objective of our efforts against COVID-19. And our main goal is really to prevent unnecessary deaths by ensuring that everyone who needs access to the health system has access to the health system. So we want to prevent COVID from getting out of control, from overwhelming our health system. And I think you've all heard the expression flattening the curve. The curve is really the number of cases per day. So as the number of cases per day increases, the curve rises and rises and gets very steep. And if if the number of cases per day and the number of cumulative cases overwhelms the capacity for the health system or of the health system to deal, then we've got a problem. So when we say flatten the curve, we want to keep the number of cases per day limited, sort of slow and low, so that the health system always has the capacity to manage cases of COVID and also other medical issues. And the only way to flatten the curve is to slow transmission of this virus from person to person. And in the long term, we hope and we know and we suspect that transmission will be reduced because most people will be immune. We'll either have a vaccine, and we're very optimistic about that, or there'll be natural immunity. Many people will have been infected and will hold natural immunity. But until then, until we have a vaccine or until we have that situation, we only have 3 strategies to fight this virus. And I'm just going to go over them quickly because I think they're important for everyone to understand, because they're the tools, the strategies that we have now. And the first is what public health authorities do. That is finding cases, testing, isolating, treating the cases, and identifying, tracing, and monitoring their contacts. It's basically this: the faster that sick people with COVID are isolated from well people, the less likely they are to pass on the virus. And this decreases the chance that one person passes it on to another, decreases the chance that we create these so-called chains of transmission. The Thai government has hundreds of people working in the field doing this very meticulous and tedious work, trying to cut every chain of transmission. And it's really important because one case that you can find today and isolate quickly today means dozens more prevented in the future. And the lockdowns, the shutdowns, the restrictions that we have, these are important to slow the virus, the spread of the virus, but it's really this work that will bring ultimately the virus to its knees. The second strategy is really what we can do as individuals, and this is super critical. And I'll talk more about why it's critical as our discussion continues. But these are the basics that we've always talked about. I call them the 4 basic measures, but it's washing your hands, sneezing properly into your sleeve to protect others, avoiding touching your face, your nose, your eyes, your mouth, and keeping a distance of at least a meter from other people. These are the critical things that individuals can do, all of us can do in any circumstance to protect ourselves and others, and they will work against COVID-19. And the third strategy is really what we're here to talk about today, and that's the one that's been used globally to slow the pandemic. And it's what we call, well, there are different names for it, but what I'll call physical distancing measures. And these public health and these are the social measures. They include the lockdowns, the shutdowns, the movement restrictions that we've been living, including work from home arrangements, the kind of things we've all been doing, or many of us have been doing. These social measures or these physical distancing measures are all meant to ensure that we keep a safe distance from each other to protect ourselves and those around us from infection. And there's no doubt that these measures have contributed to slowing the epidemic in Thailand. And the efforts that all of your viewers have made, all the people living in this country have made to stay at home, to restrict the movements, have contributed to control of the pandemic in this country. And I talk about these physical distancing measures because we're about to see some of them eased, and it's completely appropriate to do this, to phase away from these restrictions. People need to get on with earning their livings. They need to get on with educating their children, socializing, living. We know that many countries around the world are already starting to open up with far more cases than Thailand is seeing and far more deaths. So I think that the government is taking the right approach. And I think the plan for lifting the measures, as we've seen it, is slow and phased. So not everything is being eased at once. Some of the lower risk businesses and spaces will open first, followed by a 2-week period, followed by more businesses and public spaces. And this 2-week period is not arbitrary. It really is the equivalent of one incubation of the period of the virus. So when we lift restrictions on one sector or around some businesses or spaces, we wait and see or not that's had an impact on the transmission of the virus. And if things remain stable, we can then proceed. I think the strategy is strategic itself. Some activities are more risky, some places are more risky than others. We know that bars, for instance, indoor sports events, nightclubs, these are contexts that would pose a fairly significant risk of transmission and should be the last to reopen. So I think the approach is phased, it's strategic, and it's also applied to the local context. We always have to remember that there isn't one size fits all strategy for countries around the world. Thailand has to take its approach based on its assessment of risk and its assessment of the epidemiology of the disease and what's happening. But what is clear in that lifting these measures, and I'll conclude now, is that lifting these measures, every country, including Thailand, needs to be super careful. The tough reality is that we're not going to be able to eradicate this virus. And as Thailand lifts restrictions, risks from the virus will still remain. So lifting restrictions does not mean a return to our pre-COVID lives. And I think this is really perhaps my most important, my principal message today. Our lives going forward are going to be a new balance between the risks of COVID and the need to live intermittently, perhaps, with measures that impose physical distancing, like working from home, like restricting our movements. And we will likely be cycling in and out of these measures in response to local outbreaks of disease, and this may go on for the next months and the next years, and even over the next couple of years. As we lift restrictions, we'll need to pay special attention to our roles and responsibilities as individuals. And again, it's these basic things that I've been talking about, the 4 basic measures, the meticulous attention to hand washing, using an alcohol-based hand rub as often as you can, avoiding touching surfaces if possible, avoiding touching your eyes, your nose, your mouth, proper what we call respiratory etiquette, that when you sneeze or cough, it protects those around you. And again, in our personal lives and our work lives and our daily lives, trying to keep that distance of at least 1 meter from other people. These measures will be so important for us to follow, to continue to follow as the restrictions are lifted. I think just to end, there's overall good news. There's a huge global effort currently being made to find a vaccine or a treatment, and this will come. I'll be very happy to talk about that if you'd like. And ultimately, our lives will return to a situation where the virus poses minimal risk. So I think on balance, optimistic, but it's going to change our lives over the next months to year. Thanks.
Okay. Thank you very much, Dr. Kertesz. I just want to follow up on a couple of issues that you raised. Meanwhile, I want to tell our viewers that if you see us looking to the side or with hand movements and so on, it's just only because we're taking notes and we're looking at comments and questions, okay? So don't worry. Dr. Kertesz, would the vaccine, just a couple of follow-up questions. Would the vaccine be, how far away is it realistically? I mean, there's a lot of news about being 6 months away. Bill Gates says 9 months away. And other people say maybe 1 year or longer. Would the vaccine eventually be the virus stopper? I mean, we have it. Could we really resume most normal life as we did before? And then I also want to, if I could frame your comments in this way, you mentioned that we will not see a complete elimination of novel coronavirus over the next months and maybe a year, 2 years. Does this mean, sounds to me like we have to learn how to live with it. The Swedish approach is to build some kind of a critical mass of immunity. And they've suffered a bit more, but I think that they remain kind of more or less open, partially opened. And that's one model that's been, is controversial, but it's been talked about. So for Thailand, I'm thinking, maybe we should bear in mind that we will never get zero infection on any given day. If this is the case, would it be true that we would have to have an equation, let's say the health system, how much it can accommodate in terms of infections, recoveries, infections, death toll. This is kind of a sustained kind of equation that we can use maybe moving forward with some partial reopening. So what I'm saying is that, if we leave it, I'm afraid that 1 month ago, Dr. Kertesz, we were very happy with our doctors took charge, and we have a very strong health community in Thailand. The doctors, especially rural doctors, and we're very proud of our doctors and nurses and the healthcare system. I think that's why we have medical tourism and so on. But now, 1 month after, all these good doctors been working very hard, we're thinking maybe the doctors are working too hard now. Maybe they're going to aim for zero. We will never have zero infection. If that is the case, what is the kind of a balance that we could be aiming for in order to resume some economic activity and get the economy moving and get livelihoods going again? So those are just two quick ones. And then if you could add that, I also worry about the Southeast Asia context. I mentioned that maybe it will just blow over. Maybe 6 months from now, Myanmar, Cambodia, Laos, Philippines, Indonesia, we won't see skyrocketing trajectories, and then it will just kind of blow over. On the other hand, if we see a lot more numbers of infections in Myanmar, Laos, Cambodia, Vietnam, and others, with more spikes like Singapore recently, this could come back to reinfect us in Thailand. So, the region is also, we have to be mindful of. What would you say to that?
Wow, that's a lot. But let me address some of your questions. Those are really good questions and really excellent concerns. I think the first is about a vaccine. When will a vaccine come? And nobody really knows. Like I said, there are a lot of people. The WHO is coordinating a extensive network, which includes Thailand, looking into or searching for candidate vaccines, and thinking about what kind of vaccines would be the best and would be the most effective. I think the best estimates are that between 12 and 18 months before a candidate vaccine is available. But still, we don't know yet what that vaccine will look like. We don't know how protective it will be. We don't know under what conditions it will need to be stored and given. And we don't know how many doses will have to be given. So that there are many questions, beyond just finding a vaccine. There are going to be many considerations around the vaccine. The other issue too will be once we have a vaccine, to be able to scale up manufacturing or production of the vaccine so that sufficient quantities are available for those most at risk, and ultimately, we hope for all of us. There are no empty factories right now waiting to produce COVID-19 vaccine. All factories in the world that produce vaccine are busy producing vaccine that are still necessary, and producing vaccine that must continue to be given to both children and adults. So it really means developing the vaccine, but also scaling up production, and that could take some time. But it is really critical. I think that there's one issue that is really critical, and that's that as we do this, and as we search for a vaccine, and as we find a vaccine, it's absolutely essential that the principle of equity in benefiting from the effects of the vaccine is in the forefront. Everybody must have equal access to the vaccine based on need. And clearly there will have to be some, as the vaccine is produced and scaled up, there will have to be some prioritization. But equity will be principal considerations. We know that there are over almost, I believe, at last count, almost 100 candidate vaccines. I think 7 have gone into human trials. So we should be hearing more about candidate vaccines. But I think you're right. I think the best hope is for some vaccine that allows that confers immunity or protection for most of the population, and that allows to sort of get back to how we were living our lives before, and that includes lifting most of or eliminating the kind of physical distancing measures that we're living right now. You mentioned the approach about immunity and sort of the concept. I think there is a bit of a misconception, I think, about Sweden. I think that people think that, well, they're just sort of, they're very laissez-faire. They're just letting people go about their business. Some people call it the approach. I've heard it referred to as taking the punch. So people will get the infection, and the faster people get the infection, the more herd immunity there will be, the more immune people there will be in the population, the faster we'll get it over with, and the faster we can return to our normal lives. And I don't think that's the case in Sweden. I think what we've seen in Sweden is a tremendous social contract between health authorities and Swedish people, whereby Swedes have really taken upon themselves responsibility for maintaining social distancing. Again, the basic measures that we talked about. I think that in Sweden they've done a tremendous amount as a society and as individuals to limit the transmission of the virus. And I think that's maybe one of the important lessons, is that no matter what happens as we lift these restrictions, we all people living in Thailand, all people living everywhere, have a responsibility to protect themselves and others by following the basic measures which we know work. There have also been some studies recently, and these are sort of just coming out, looking at the concept of immunity in the population. One of the things that we can do is we are currently developing tests that will measure levels of antibodies or levels of protection against the virus in the population. So, and this would be a blood test, and it would basically measure each individual's sort of immune response to the virus. So we could do a test on, say, 100 people, and we'd find out that 25 of them had these antibodies. and we could make some assumptions about whether they were immune or not or protected. And I think this work is it's really still in research stages. We don't know, for instance, when we measure these antibodies in people, whether or not the presence of these antibodies actually confers protection against the virus. So we don't know that people who have antibodies, we don't know to what extent people that have antibodies of virus because they've been infected are actually protected from reinfection. We don't know how protective these antibodies are, but they do help us to understand a little bit the sort of infection rate in the general population. And I think that the initial studies are showing that relatively few people have been infected in most populations so far. I mean, some of the studies have shown between 5 and 20%, depending on where the study has been done. So I think that we need to be cautious about this approach of sort of letting the virus, letting it rip, so to speak, because we are not seeing a lot of immunity already in the population. So we need to be very careful. And I think, as I said in my opening remarks, we need to be super careful not to underestimate the potential of this. Our elderly, our compromised. This is what we need to remember. This. Let's not ever
Thank you.
For granted.
Thank you very much, Dr. Kertesz. We'll come back to you again. So basically, there's just too many unknowns for us to be complacent or to relax the various measures, and we have to maintain some vigilance. That's appreciated. Let me turn to Dr. Kirida. So for Thailand, like most other countries, we have to grapple and come to terms with the costs of handling and managing this virus. I mean, the Thai economy is projected to contract by the Bank of Thailand. I think it's 5.3% or something around that range, and then by IMF even worse, 6.7% contraction. This is this harks back to 1997, 1998. This is a severe negative growth, deep contractions, and it will lead to job losses, corporate bankruptcies, and so on. And so the government has come up with a stabilization package, not stimulus, but stabilization package of 1.9 trillion baht. And a lot of people are trying to apply for this 5,000 baht a month subsistence subsidy from the government. And so we have a lot of bad news on the Thai economy. Now, there's some partial reopening of businesses. And I'm still looking at the logic of this reopening. Some shops can, some shops can't. And I think it has to do with the physical distance and the nature of the business. What do you think about the economic contraction? And at this time, do you think that maybe should the balance be to take a little bit more risk, a little bit more health risk, virus risk, and then to take a bit more economic opportunities in order to mitigate the economic hardships and sufferings to come this year and next year? Dr. Kirida.
Thank you so much, Dr. Thitinan. Thank you so much for inviting me back here again. Good morning, everyone. Well, it's a tough time for everyone, as Dr. Thitinan has mentioned. And what I'm going to actually describe today is, to sort of put what Dr. Kertesz has said in an economic context. So what does it mean for the Thai economy when the pandemic seems to be going the way it's going? So, just, as a broad message, I think this crisis is going to be deeper than the East Asian financial crisis or the Tom Yam Goong crisis as we know it in 1997 and 1998. Because at that time, the crisis was contained mainly in Thailand and in the East Asia, Southeast Asian region. While the global economy was still doing well, the baht was depreciating, so exports were, still helping to support the Thai economy. But today, every single sector, every single region of the world has been affected by the COVID-19 pandemic. Demand is down everywhere. So it's a much deeper crisis than the Tom Yam Goong crisis. So in my view, I won't be surprised if the Thai economy were to contract by, let's say, 10% this year. Just to give you a context, in the Tom Yam Goong crisis, our GDP or our economy contracted by 8%. And as I mentioned, this is a much deeper and wider crisis. So, it's going to take a big toll on, people's, incomes and welfare, and also on businesses as well. So I've prepared a few slides, which I would like to share with you so that you could see some of these as your visual aid on how, we see, all this panning out over the next 12 to 18 months. As Dr. Kertesz mentioned, we would need to find a vaccine, and most people would have to be vaccinated before all this is under control, and people are comfortable going back to their daily lives and their daily economic activities. So we could be with this for the next 18 months, which would put us, to the last quarter of next year. So we're in a long haul for this. And the important question here is, how do we strike a balance, right, between the health risk and the economic risk that would come about? Because we don't want to see after 18 months all this is under control, but the economy has gone to shambles, and poverty rates have risen, domestic violence and also crimes have risen. That is not what we want. We want to position ourselves well for the recovery. So, as you can see, many countries have already started to relax their lockdown so that economic activities can begin. But at the same time, also keeping in their minds that health risks are there. So, for example, France will reopen in the middle of this month. China has already started reopening. But again, as Dr. Kertesz mentioned, there's always a possibility of a second wave of outbreak. So that has to be kept in mind. Relaxation of lockdown can occur, but then it could be locked down again if the outbreak comes at a second wave. So let's see what's happening in Thailand right now. How are we relaxing those constraints? So in Thailand, we are, as Dr. Kertesz says, we're cautious. We're very cautious. We're cautiously optimistic, and we're very cautious in reopening or relaxing our lockdown. So as you heard yesterday, some of the smaller, businesses that are in open air, not in air-conditioned, rooms, most of them can be reopened now. I mean, hair salons can be open, but they can only be, doing washing, drying, and cutting services. All this is because we would like to, maintain the health requirements that will reduce the risk of the outbreak. So what are those? Those are maintaining physical distance, not being in a place for more than an hour at a time, right? Wearing masks, cleaning facilities, having temperature checks for your clients, and also very importantly, you must be able to trace people. For example, if a person enters a shop and 14 days later, he or she is found to have, contracted the COVID-19 virus, other people in the shop at that time should be notified. So there's a tracing, system that has to be in place, and this is now being developed by the private sector, which is a part of the committee that is advising the government on this reopening. They have developed an app that will be put in shops where when customers go in, they can scan this QR code, and it's using the Line app, which everyone has, and you can just put in your name and phone number so that if anything happens, the authorities can contact you, and that's a way to to trace and contain the virus if it should happen. But as I mentioned, we are very cautious, so we're opening up only these very low risk businesses first, and then we'll move on to the low risk, then to the medium risk, then to the high risk. And I've listed here the different businesses that are in each of the risk levels. So, for example, as I mentioned already, the very low risk, they're opening on the 3rd of May. These are activities or businesses that the risk of the virus, being contracted by their customers are pretty low. Then, the low risk sectors include, for example, department stores and malls, and the larger air conditioned places where lots of people will go to. I mean, those will come next. But as Dr. Kertesz mentioned, for each of these reopening stages, we will try for 14 days and see how it goes. If the outbreak comes back or more contraction occurs, then of course we would have to then relook at this and maybe relock and then reassess all this again. So we're very cautious in reopening, but we realize that we have to start reopening. Why? Because it's just 6 weeks. And so many people, in the country are being affected now. They don't have incomes. They have creditors knocking on their door, loan sharks knocking on their doors. They, don't have means, to find more income. So that's really affecting people's, welfare. And as I said, one of the reasons why these are very low risk businesses are reopened first is because they employ a lot of people. So I would like to show you, the number of people who are actually affected by the lockdown is huge. And those who are severely affected is almost 10 million of them. And the majority of them are actually in the retail sector. I'm sorry, some of these names have disappeared from the slide, but the top one is the retail sector, which and, hotels and retails, which this is retail, sorry, which employs around 5 million people. So that's a big sector. So relaxing, the lockdown on these small shops, on markets, do help a lot of people, to regain some of their livelihoods. So this is one of the reasons why we want to start with these low risk activities, which has a high employment. Another sector which has a high employment as well and is affected is the agriculture sector. It's affected from drought, but also from the COVID-19. Drought is definitely the main factor that's affecting agriculture incomes this year, because production is pretty much down from the drought, whether it be rice, rubber, or even sugarcane. For example, sugarcane production this year is only 60% of last year. So it's pretty heavily affected. But the COVID-19 impact is also felt by the agriculture households. Why? Because, for example, rubber tappers cannot go out at night to tap rubber, which is when they go out to tap, which is when they tap rubber. So the curfew that is being imposed because of the COVID-19 outbreak is affecting rubber tappers. But more importantly, we find that half of the agriculture household incomes actually come from non-agriculture activities. So during the off season, or like when there's drought now, but there's not much to do, usually agriculture household members go to non-agriculture economic activities, and they earn some income from that. And they also get remittances from their family members who are in the non-agriculture sector. So when there's a lockdown, this part of their income, which is a pretty large part, almost half of their household incomes, decline. So this has also affected a lot of the agricultural households. So as you can see, this has not only affected people in the retail sector, or in the manufacturing sector, but also in the agriculture sector as well. So we have done a little calculation as to how much consumption will decline if this goes on, right? So we have calculated this by month, because if next month things gets better, we can then adjust, the numbers here. But if you look at the fall in consumption, you can see that, in the different income groups, of course, the income groups with higher incomes would see the consumption fall more, because they have goods that they can do without, to put it simply. But those poor income households, have very few items in their consumption that they can cut. So we see, a lot of consumption being cut by the higher higher income households. And this all, totals up to around 65 billion baht per month of fall in consumption, which is around 0.5% of GDP or 0.5% of our economy each month. So if this goes on for 12 months, that would be, a 6% reduction, right, in consumption in a whole country, which is massive. And it, of course, then affects the production, because when purchasing power is affected, then businesses are also affected as well. So if we look at what businesses are being affected, you can see that, almost all businesses are affected negatively. The ones that have the highest negative impact being felt on them are hotels, airlines, and on the left-hand side is the number of employees. So here you can see that hotels and shopping mall, retail shops, even rubber production. These are the ones that hire more than 1 million people in their businesses. So these are most affected ones, and they have lots of people in them. So this is one of the reasons why you want to start relaxing these lockdown on these sectors. Of course, there's some positive opportunities for certain businesses. In every crisis, there are opportunities in e-commerce and delivery services, in digital services, medical supplies, or even insurance. But in the bigger scheme of things, right, these are just a few sectors compared to the ones that are heavily affected by the lockdown due to the COVID crisis. So, if you look at the reasons, that different businesses are severely affected, well, that's because one of the biggest demand in the country, other than the domestic consumption by households that I've already mentioned, is international tourism, which actually accounts for around 12% of our GDP or our economy. So we're actually going to not see this, right? This income, this 12% for the next maybe 12 to 18 months. So, this is going to be a big impact. I mean, we're not going to see consumption from almost 40 million people who used to come into our country. So this is going to be a big impact on many businesses, as I mentioned earlier, that rely on international tourists coming into Thailand to purchase their goods or services. But not only tourism is affected, right? In this crisis, as I mentioned, which is different from the Tom Yam Goong crisis, even Thai exports will be affected, because the global market, as you may have seen, the IMF has forecasted that the global economy this year will contract by 3%, which is probably the largest contraction in 100 years. So, the countries that are most heavily, facing this economic contractions are the US, Japan, EU. So all these are large export markets for Thai goods. So when they are affected, of course, our exports are affected as well. So we will see this impact on businesses that export, whether it be automobiles, there'll be rubber, there'll be electronics. These will be affected by the COVID-19 pandemic as well. And don't forget, exports is around half of the Thai economy, 50% of our GDP, right? So if this is down, and we expect it to decline by around 10%, it definitely takes a toll on businesses as well. So this is, something that is difficult for us to control, meaning that we could relax the lockdown, we could be producing, but there's no demand from the global market. I mean, that or very low demand. So the export sector will be quite affected as well. So that I've gone through household consumption in the country. I've gone through tourism revenues. I've gone through export revenues. I mean, nothing is doing well. So the only thing that is our hope now is the government support. And the government is now supporting basically individuals, but also businesses. So let me just explain this in a bit. I mean, the royal decree that is now effective is the one that allows the government to borrow 1 trillion baht, which is around 6% of GDP, right? I mean, it helps. So this 1 trillion baht will be borrowed and will be spent about 600 billion will be spent on cash handouts. So we expect this to go fast, right? It's for the 5,000 baht per person per month. It's going to go to hospitals, to healthcare sector. And then there's another 400 billion that is going to be used for small investment projects in the villages, in the tambons. Well, this one will probably be slower because they will need to go through the normal procurement processes and get approval from the local government. So this will be slow. But again, I just want to mention to you that 1 trillion baht, or equivalent to around 6% of GDP, is not a lot. It's not a lot. And there's room to expand. Why I'm saying this? The reason I'm saying this because even with this 1 trillion baht loan, our public debt to GDP ratio now stands at around 48%. And the usual maximum benchmark for public debt to GDP for emerging markets is 60%. That's the level where we will be able to repay these loans easily. So it's sustainable, as economists say it. So for Thailand, we still have another 12% of GDP room before we ramp our public debt to GDP up to 60%. So 12% of GDP more that we can spend, that's around 2 trillion baht more, right? So we can still borrow and spend more if we need. So that, I think you can discuss in the second part when we come to the discussion part of what we should be spending this on, because that's the more important question than how much we can. So we know that we have scope to spend, but what are we going to spend them on? The other 900 billion baht, which has been announced, that are measures by the Bank of Thailand. That's not borrowing. That's actually asking commercial banks to provide soft loans to SMEs, where the Bank of Thailand will subsidize part of the interest rate. So that's where this is coming from, the 500 billion baht soft loans. And there's also the 400 billion baht fund, which is established to help the corporate bond market. And that's because large corporates, especially last month, have found it very difficult to roll over their debt because investors were very nervous and wanted to hold cash. So even corporate bonds with AAA ratings, even government treasury bonds, which have very low risk, have been sold hugely by investors because they don't want to hold anything but cash at that moment. So this fund actually came out to calm investors down. It might not be used in the end, but the more important effect it has is to calm investors that, look, you can go back and hold these very good bonds. We call them rated bonds, because if not, the Bank of Thailand will go in and buy them anyway. So their prices will not fall. So that is to give confidence to corporate. And why do we want to do that? Large corporates have very long supply chains. So if they're in trouble, their suppliers will also be in trouble. And we don't want that to happen because most of their suppliers are small and medium enterprises. And also most of the, 40% of the people who hold these corporate bonds are actually people like us who invest through mutual funds or to the, social pension fund. So, it has wide implications if large corporates were to have trouble. Also implications for the banking sector, right? If the large corporates don't do well, the banking sector might face problems as well. And we don't want that to happen in our economy. That's a big risk to our economy if that happens. So I think I will not say much more, except that, there's some good news that I want to leave in my presentation. One is that, the baht will be weaker. So, from 30 baht last year, this year it will probably be around 32 to 33 baht, which is probably good for exporters who can still export, because when they convert their revenues from dollars to baht, they get a bit more than last year. So if you can still export, that's good for you. And the other good news is that crude oil prices are falling, and that's good news for Thailand because we're a net importer of oil. So oil this year will probably average at only 33 dollars per barrel, and that's good for Thailand. But of course, one of our major export markets, which is the Middle East, won't do well because of this slump in oil prices. But otherwise, I think on the net basis, lower crude oil prices will be better for Thailand. So that's how I see the Thai economy going forward, and we can discuss more. It's going to be a deep crisis. We have bits and here and there bits of good news, but not much. Majority of the news on the economic front is not good. So everybody's looking forward to a relaxation of the lockdown, so that domestic consumption can resume. But again, of course, health considerations would have to come first before any of the relaxation can take place. Thank you.
Okay, thank you very much, Dr. Kirida. It's very comprehensive and a lot for us to digest and think about. In fact, it's actually very alarming, and we have a lot of negative news on the horizon. I'll come back to you shortly. There's a question for you from former Australian ambassador to Thailand, James Wise. Whether this would be a chance, opportunity for a wholesale, massive restructuring of the Thai economy, given what's happened. I'll also come back to you about a deep contraction of 10% that you have projected, because that means a lot of repercussions. I mean, you look at the 1997, 1998, the world economy kind of was a cushion, and the Asian financial crisis, Thailand eventually recovered. 2008, 2009 global financial crisis. It was very deep, and it was devastating for the Western economies. But largely Asia was all right, and eventually we kind of pulled through together. This time, I don't see how we can all pull through together. So I'm going to come back to that. We have a lot of questions and comments. I'm very sorry that I cannot read all of the questions and all of the comments, but they're on Facebook. Dr. Kertesz, there's several questions for you. First, about the possibility that, I'm reading from my phone now, the possibility that we may have to learn how to live with the virus, with coronavirus, without vaccine. I mean, there's a question from Dr. Abhishai Santinda, COVID-19. We've had HIV/AIDS, MERS before. There was no vaccine. It could be that maybe no vaccine possible. And another question for you, Dr. Kertesz, from Mr. Willie Tam, who used to be the head of the HSBC Bank in Thailand, now living in Malaysia. He asked, what's the real mortality rate? If you isolate, the death toll, those who have had pre-existing conditions, maybe a mortality rate is not as high as we think. We've been seeing 3%, 4%, 5%, but maybe, a lot of those cases, in fact, overlap with pre-existing conditions. So do you have a number on that, like a real mortality rate? And there's several questions about lessons learned. We've had outbreaks of Ebola and, SARS and MERS and other pandemics. Have we learned anything? I come from a think tank. And, in a think tank community, we talk a lot about so-called non-traditional security. This is, the pandemics is one of them, but it's also transnational crime and the floods and the hurricanes, typhoons, and so on. But have we learned anything? Are we looking at a regular flow of this kind of pandemic every few years or so? And lastly, I know there's a lot for you. You don't have to answer everything, Dr. Kertesz. What's the correlation between coronavirus and temperature? And the temperature, how hot it is in Southeast Asia. Is this why the numbers are so low in Southeast Asia? Please spend a few minutes answering, pick and choose. You don't have to answer everything. Go ahead, Dr. Kertesz.
I'll try and answer as shortly and succinctly as I possibly can. First of all, I just want to thank Dr. Kirida for a great discussion. Yeah, I think in my next life, I would have loved to have been an economist. I think it's so interesting. And, I just think these are, we're so preoccupied with the public health elements. it's really important that we fully understand the impact that this disease is having. There was a question about the vaccine and what if there's no vaccine. I think the coronaviruses are different than other viruses. It's true that some viruses and some other germs we have difficulty in developing effective vaccines. But we do have some experience with MERS, and we do have some experience with creating vaccines around SARS. So we think that we still believe, based on our experience, that a vaccine for coronavirus will be possible. But again, there are still some unknowns, as I talked about. How many doses would be necessary, how effective it will be. And remember that even a vaccine that is 20 to 30% effective would even though on paper 20 to 30% doesn't seem that much, a vaccine that's 20 to 30% effective would have a massive impact on human lives, on saving human lives. So there will be lots of considerations, but I think we're optimistic for the development of a vaccine. There was a question about mortality rate, and indeed, that's something that remains unknown. First of all, we do know, and it is clear that people who are older, that are elderly, sort of 60, even 50, 60 and above, and are clearly at risk for more severe disease and more severe outcomes like death. This we know, and we know that that being older and having some sort of what we call comorbidity or some sort of other underlying condition like heart disease, diabetes, kidney disease, increases beyond age the risk for death. So we know that mortality rates are higher among older people, and that's something we're learning from our experience around the world. What we don't know is the crude, what we call the crude mortality rate, and we don't know that for a number of reasons. When we talk about mortality rate, we're really talking about the case fatality rate, what we call case fatality rate, which is the number of people that die divided by the number of confirmed cases. So we have a numerator and a denominator, and we certainly know the numerator. We know more or less how many people die, because most people would in most contexts, or in the context that we've seen, would present to some sort of health facility. What we don't know is how many people actually have the disease, what the denominator is. We know that there are many people out there with mild infections. In fact, most people have mild infections and have symptoms that would not necessarily induce them to go to a hospital or a health clinic. So we don't know what the denominator is. So it's very hard to estimate what the crude mortality rate is. But you're correct that the current what we're currently seeing is about between 2 and 3% crude mortality rate. But because we think there are lots of people out there who don't present to the health system and go undiagnosed, that's probably a high rate. A question about temperature. It's a really, I call it a tantalizing hypothesis. I mean, we don't know. It's been brought in again, whether or not the virus behaves differently in temperate versus tropical climates. And it's just something we don't think. We know that other viruses do. We know that influenza does. We know that influenza behaves in a seasonal pattern that's different in northern and deep southern hemispheres than it is in the tropics. But I think we have to wait and understand and study this coronavirus more to see if it follows the same pattern. Nobody believes that we should be doing any planning or any forecasting based on that hypothesis. We need to expect the worst from this coronavirus in temperate climates, as we've seen, and in tropical climates as well. And lessons learned. Indeed, we continue to learn lessons, although, and there are some basic principles to managing pandemics, although every disease is different, obviously. And I think one of the things we've learned is the absolute necessity for preparedness. That investments in preparedness, in developing health infrastructure, developing the capacity of public health authorities to quickly identify, isolate cases, laboratory capacities for testing, abilities to trace contacts, and all of those systems are systems that many countries simply don't have operational right now. And we know that in Thailand has, I must say, has a very impressive public health system, and has currently shown its capacity to do that kind of basic public health, shoe leather public health work that's necessary to control. So again, the lesson is really about preparedness, and the other big lesson is about the need for global networking and sharing of information. And we have now available to us networks of clinicians, epidemiologists, laboratory people, social workers, just these huge networks, global networks that are working on this problem that we didn't have available to us even 10 years ago. So the idea that no one organization or one entity can be responsible for it all, but we all have to work together as part of networks to share information and to share science and do good science, so that we can come to conclusions based on the best evidence. And those networks certainly exist today.
Just very quickly, Dr. Kertesz, by the way, I want to promote audience participation and promote this kind of a community online that we have. The question about the temperature correlation with the virus potentially comes from Gwen Robinson, who is a senior fellow with ISIS Thailand, also the president of the Foreign Correspondents Club of Thailand. Very quickly, Dr. Kertesz, a question from a Thai ambassador in Jakarta, Ambassador Pasapon Sang Suban. How do we explain Vietnam? Seems to be anomaly exceptional that Vietnam has had very low numbers, it's been very vigilant on top of it. And very quickly, do you have any recommendation or advice for ASEAN as a regional organization to handle COVID as a regional challenge?
Yeah, I think, there's so much, again, about this virus that we don't know, and it's hard to know why the virus behaves in some ways in certain places and it does in others. In some ways, you might ask, what's happening in Thailand? Why is it that we've seen, we were the first country outside of China to isolate this virus? How is it that we haven't had a sort of an explosive situation here? And again, there really isn't anything magical. It's a combination, I think, of the three things that I talked about: a vigorous public health response, the measures that individuals take to protect themselves, the washing of hands, etc., and the public health and social measures, the physical distancing measures that we've all been living. There really isn't anything that's known beyond these three things that works. So that the fastidious application of these three things is our best bet to control the virus. And I think there will be deep dives, I'm sure, into what's happening here in Thailand, what's happening here in Vietnam, to really understand what's going on. But I think those are lessons we still have to learn.
Okay, thank you very much, Dr. Kertesz. Now, I'll ask our tech team to leave the three of us on the screen now for the last 20 minutes or so. I'll come back to Dr. Kirida now about the deep contraction. I mean, this is very worrying, because if it's this bad, you gave a very comprehensive, in fact, PowerPoint presentation on the prospects, on where we are. And by the way, our viewers can go back and look subsequently in some days from now, from tomorrow. I think we'll have it on as a recording. If it's 10% contraction, unlike 1997, 1998, there's no IMF. There's no, IMF is not readily available, and the world economy is really challenged at this time. So Thailand's fiscal space is really what we have to work with, and the fiscal space is pretty. On the one hand, there's some space, but on the other hand, how sustainable is it? I mean, we're working from 44% of public debt to maybe up to 57, 58%. We will reach the ceiling, the legal ceiling for Thai public debt per GDP at this rate. And then do we change the law to increase that ceiling, to lift that ceiling? That's something that will lead to fiscal sustainability issues. And also, the debt servicing down the road, because that's one big concern on the debt picture for us. But beyond that, Dr. Kirida, if you look at exports, not going to lead Thailand out of this crisis, the Thai economy. I mean, and I think that there will be a credit, a credit crunch. I mean, there will be some corporate bankruptcy. So the financial sector not in a great health going forward. Consumption obviously very weak because people don't have jobs and income and so on. So we're looking at a very dire situation. Would this lead, this comes back to the question by Ambassador James Wise, who has written a book, by the way, on Thailand recently. He wants to know, and I think many people will, if we're going to take something positive out of this, maybe this is a chance for Thailand to bite the bullet and impose structural reforms in the Thai economy, massive wholesale restructuring of the Thai economy. If this is the case, where do you see what should be the priority areas? Since we can have a crisis anyway, how do we make the best of it? What kind of restructuring and reforms can we do? Dr. Kirida.
Thank you for those questions. I see there are two questions that you posed. One is on how much the government spending can actually sustain Thailand's economy going forward. And the second question is, in addition to those spending, what kind of reforms can be undertaken so that once all this is over, meaning it's a post-COVID world, we are positioned stronger in that recovery. Let me answer the first question. The first question is, yes, you're right. We have another sort of like 12% of GDP, fiscal space if needed, which is around 2 trillion baht to spend if needed. And I must say, even the first, 1 trillion baht that we have borrowed, we have not fully spent it yet. So there is room. But the more important question, as I mentioned earlier, is what do we spend it on? Because if we spend it on something that would actually lead to a recovery of the businesses and more incomes, then in the end, the government will not need to put in so much money. So for example, we're now giving cash handouts, to individuals at 5,000 baht per person per month. Well, that's to help the vulnerable groups to get by in these 2-3 months when there's a lockdown. But if the lockdown is relaxed, which we're coming back to that again, then there will be more incomes accruing to people. Probably not as much as the pre-COVID levels, but there will be more income. So that would then make governments, spend less on these cash handouts that they need to give to people. But I think it's also important to see how the government actually support businesses. We haven't really seen that. We've seen cash handouts, to individuals in Thailand, but for example, in Australia or in the US, the government actually gives, subsidies to businesses so that as incentives for them to keep their employees. So that is one way to go, because if businesses are also supported, once a recovery happens, especially smaller companies, they don't have much liquidity and they can't last more than 2 to 3 months without sufficient income. So if there is that kind of liquidity line to them, then they can recover once the demand comes back. So, that's, I think the more important question, as I mentioned, is how do we actually spend that money so that it generates growth and income so that the government would not need to be supporting everything in the economy going forward. So I think that's the question. The question you had for the first question. The second question is, are we wasting a good crisis, right? Because we now have realized that there are so many weaknesses in our system, and we know it from before. And this actually crisis exposed many more weaknesses, and it's probably time to address them. But of course, in reality, we're fighting the fire now. Right? In these first 3 to 4 months, businesses and government are fighting fires. Only very strong businesses can think about the post-COVID world and how to position themselves. The government, similarly, is now fighting a fire. I think it would take them another couple of months to get on their feet to say, okay, now we're going to think about the post-COVID world. Businesses or start restructuring or whatever, because at the moment, I mean, people are not ready to undertake a lot of restructuring at the moment when they're struggling for their livelihoods. So I think it's as Ambassador Weiss says, it's definitely important for Thailand to think about repositioning itself post, in the post-COVID world. But maybe it will take Thailand another few months before it can get to that. But if I may, throw some ideas on what kind of reforms or restructuring that we can take, so that we are stronger in the post-COVID world. For example, I mean, digitalization. I mean, we have, try to go digital in the country for a very long time. But we haven't really succeeded, and there's still many laws and regulations that are impeding that. For example, electronic signatures are not really recognized, right? I mean, you still have to do face-to-face meetings, and there are things like that. So it's it's an opportunity for Thailand to go digital faster, at a much faster pace than it used to. And of course, this would include a lot of new policies around the digital economy, and also thinking about how do we get people to be more engaged, right, in the digital economy. I would just like to give an example that schools, right? Yeah, Thitinan can relate to that. Can they go digital, or at least 30% digital if needed? At the moment, it's still quite difficult in the education sector, because not all students have access to internet, have access to tablets or even laptops, right? I mean, only a few people, actually students in Thailand from richer families, have those equipments. And you might know from your experience, even college students, not all of them have laptops and good tablets and good internet connection, because all these are expensive. So again, you have to really rethink of all this in a very comprehensive manner if one wants to go digital. And I think that's something that the public would sort of ally with, because they've seen that it's possible, and they've seen the necessity during this time. Other things, for example, I'm just giving examples now. Tourism, right? I mean, we've talked a lot about ecotourism, the ones that are friendly to environment, but we haven't done much in a very long time. Maybe this is time to rethink that. After these 2 years, when international tourism comes back, we want to position ourselves as a more, eco tourism destination. That might be. So there are many things that we want to think of, including, let me just say, coordination of the government. Right, this crisis has actually, sort of made it quite visible that government coordination in Thailand is not very strong. So that's another big area I think that needs restructuring, is the government coordination operations themselves. So I'm just throwing a few ideas. Of course, there are other big reforms that needs to be done. How do we restructure from agriculture to services, or to manufacturing? What kinds of manufacturing? I mean, there are more things to think about.
Thank you very much. Before COVID-19, Thailand needed. It was imperative already before COVID that Thailand needed to restructure. So Thailand's been in the middle income trap. We were talking about education reforms, economic upgrading. I mean, these issues now have been exacerbated now by COVID. So it's almost like a double whammy. On the one hand, we needed this restructuring already, but now with COVID, you can see that the bureaucracy has been exposed for being very inert and very inefficient, with a lot of interagency conflicts and this and that. So, Thailand is not alone, by the way, but, we can see in our country, in Thailand, that there's been a lot of flaws and weaknesses exposed by this crisis, and the restructuring is that much more urgent. I'll come back to you in a minute, but I want to ask a little bit to Dr. Kertesz. I mean, there's a question from Dr. Kirida Bhaopichitr, a professor at Thammasat University, about the flattening curve. So in a way, Thailand has flattened the curve, and this flattening curve has become the global motto for handling and overcoming coronavirus. But is it the case, going back to our original remark about testing, Dr. Kertesz, is it the case that maybe we need to do a bit more testing to really ascertain the real numbers in Thailand? Maybe not enough testing going around. Is that the case? Dr. Kertesz?
So I think, Obviously, just a quick word about testing. I mean, we do testing not just for testing's sake. We do testing anywhere to find the virus, to find people who are infected with the virus. And the reason to do that is so that you can take some action. You can actually then, and the assumption is that your system then has the capacity to, once people are identified through testing, to isolate them, and treat them, and then identify their contacts, quarantine their contacts, and monitor and follow their contacts for a period of 14 days. So really out there we test because we need to find people who have the virus, who want to know where the virus is, so that we can eliminate these chains of transmission. So testing is a strategy that's really important. And WHO recommends, and I think we all understand the importance of finding and testing anybody who is symptomatic with COVID-19. We do not recommend a strategy of testing whole populations because, for a number of reasons. But one is that we're pretty sure, based on the current evidence, that it's really symptomatic people, even people who are mildly symptomatic, that are driving transmission of this virus and creating these big outbreaks that we're seeing. So it's really important that we have the necessary surveillance to identify people with COVID-like symptoms, and then the capacity to test them. And I think Thailand recognizes the importance of this, and they have expanded their case definition, their criteria for testing. I think they're continuing to expand their laboratory capacity. They're continuing to expand their search for COVID cases into the community. So there are current strategies now to test in populations where clusters of cases have been identified. So testing massively in those populations, looking for cases of COVID there. There are plans to test in centers which there's a network of centers in Thailand, like in many countries, that do surveillance for influenza-like illness, so that they monitor influenza every year. They monitor patients that have influenza-like illness, so that they can predict patterns of influenza. But because influenza and COVID present in very similar ways, if through that sentinel system, or these different sites, you can identify people with influenza-like illness, but who test negative for influenza, and you can test them for COVID, you have a way of identifying what's going out there what's going on out there with COVID in the community. So that there are strategies to expand surveillance and testing into the community, but it is extremely important to be able to identify people with this virus and target your testing to those people.
Thank you. We have just a few minutes left. I want to kind of conclude by inviting you both into this kind of questions, framing it in a way. We need medical doctors, and we need economists and other disciplines. But I think Dr. Kirida, you see that Dr. Kertesz has said that he wouldn't mind being an economist. So this is something that maybe you should go teach economics, and you can inspire people that way. But I want to come back to this restructuring of Thai economy. Last week we had Dr. Supavuthai suggesting very point that you just mentioned about tourism. 12% of Thai GDP, lots of numbers, 36 million last year, almost 1/3, 11 million Chinese. Lots of numbers, a lot of quantity. But maybe this is a chance to restructure and maybe look at a greater quality, ecotourism, medical tourism, and so on, and make Thailand a wellness center. So, going forward, maybe we can start to look at what can we do right now. In the economics, political economy, economic development, one major theme is that crisis always leads to some kind of a change and adjustment. So for Thailand, going forward, which areas should we be thinking about now to get it right, to kind of, take this as a kind of a chance, an opportunity to have a new slate, not a blank slate, but a new slate to get things right, because they were wrong before COVID. And since COVID is here, so maybe you can talk a little bit about that. And then I'll invite Dr. Kertesz to have the last word about, we in Thailand, we seem to have the situation under control. So things could still go very wrong. So if you can talk a little bit about what would be your foremost fear, concern going forward for Thailand? And if you can tell us just a little bit about, we are mindful of ASEAN, Southeast Asia. Do you have any advice, going deeper into the ASEAN context? What should the region be doing as a regional organization? So let me go to Dr. Kirida first. What do we prioritize? Restructuring, we have a crisis, don't waste a good crisis. This will be massive crisis, not like 97, 98, even worse because the world economy is much more adverse, and even worse than 2008, 2009 because it's right here and right now. So, how do we go forward from here?
That's a $1 million question. And I think there are many areas that we will need to work on if we want to position ourselves, to be stronger in the post-crisis world, which definitely will be quite different from this. What I would suggest is actually policies that will actually have buy-in from the public as well, so that it would be implementable. For example, we always talk about wanting to improve productivity in our country, and there are many things that you can do to improve productivity. One is education reform, right? Which we've been talking for 20 years and we haven't done that. So one of the things that I suggested earlier, for example, digitalization of education in some sense, not all, but in some areas, maybe that would increase access and increase the efficiency of education to our youngsters, and including education for current workers, because we're an aging society. We would like to upgrade and upskill even in mid-career, and and online courses, digitalization. So education reform, I think, would be one that we can position, and I think everybody would buy into that, especially putting in that digitalization spin on it as well. So that's one. We have always talked about upgrading our technology. Here again, this crisis presents the need to upgrade our technology. Many are going digital as well. Many are moving towards automation. They might have been thinking about automation for a while, but this crisis actually, propels many factories to go more automated because they're afraid, of the contagion on their factory floors, for example. So, that this sort of restructuring towards higher technology could be one of the things that we would be able to push forward. And of course, in the agriculture sector, that's the biggest sector that we've always talked about, that we have 33% of our labor force, a third of our labor force in agriculture sector, but their productivity is very, very low. Only 7% of our GDP comes from agriculture, right? So this is, again, a time to say, look, we would need to restructure our agriculture sector as well, to position ourselves well for the post-COVID world. And I must say the post-COVID world will be a bit challenging because a lot of countries are now thinking about food security in their own countries. They're thinking about security and in other aspects as well, but food security is one on top of their minds. So many countries might be starting to try to produce their own food to a certain extent, or diversify their sources of food. And that might impact our exports of agriculture produce as well. So that's an important thing that we must think about, and maybe try to move to other products, or be more agro-industrial based than we are today. So those are a few things, so in a very short time, that I could think about.
Okay, thank you very much, Dr. Kertesz. So what would be your foremost concern for Thailand, and maybe a bit of a word or two for ASEAN in handling COVID?
So concern, I just think that the message is really that until a vaccine is available, or some therapeutic entity that reduces the severity of this illness, or makes it a less severe illness, we've only got the 3 strategies that I talked about in my opening remarks to manage this pandemic, this situation. And one of those strategies is all of the lockdowns, shutdowns, the restrictions that we've been seeing. Now, Dr. Kirida has extremely eloquently outlined the impact that these restrictions are having. And it is entirely appropriate that we should be considering lifting them now. And I think all the measures that the Thai government has taken are in the right direction. But we have to again think of this as not moving away from restrictions, but moving towards the other two things that will be necessary to ramp up in order to control this pandemic. And those two things, again, is the health sector response, the health workers and the public health system's capacity to identify, test, isolate, treat, trace, and quarantine contacts. This is so important. And it seems technical. It is technical, but it's the health system's capacity to do this will be the deciding factor. And the second thing, of course, is that we need to emphasize as we move away from restrictions, appropriately so, is what each individual living in this country can do to protect him or herself and others from this virus. And it's, again, the four basic measures. The tools are simple but well worn. Hand washing, avoiding touching your face if you can. Difficult habit to break, but avoiding touching your face. Respiratory etiquette, and maintaining in your life as much as possible that physical distance from others. These are the measures that we need to now emphasize. We need to get all communities, all peoples around these measures as we move away from restrictions. Because we don't have a magic bullet solution yet. This is all we have, but we know that they work. So we need to emphasize them. ASEAN, I think I think what ASEAN countries should do, and I think that they're already doing them, but I think what any group of countries or fora like ASEAN can do is, I think, it's all communication and sharing best practices. We're all learning about this virus, and all countries are having different experiences. So sharing best practices, sharing what we know works, sharing technical innovations, sharing our experiences with the work that we're doing, that each country is doing on vaccines and on therapeutics, sharing experiences like the utility or the value of having village health volunteers involved in the response and how that works. So again, countries are stronger united than they are alone. And I think ASEAN countries have a lot to learn from each other. And I think the other thing that they can do is united, they can continue to lobby for technology transfer, for things like vaccines and therapeutics, for involvement in clinical trials, the kind of tests that need to be done to show whether vaccines or drugs are effective against COVID. And perhaps most importantly is continuing to advocate for equity in reaping the benefits from what comes out, the kind of therapeutics and vaccines that are developed. This will be a critical principle, and I think fora like ASEAN can have to continue to advocate that for their people.
Thank you very much, Dr. Kertesz. So in the meantime, while we wait for the vaccine, I think that would be a pivotal, a key development when that happens. And for your strategies, I think some of this is very long term. These are permanent changes about hand washing, some physical distancing. That's all good. Those are the knowns. And the unknowns, we have a lot of unknowns that we don't. We don't know how the virus will kind of meander and exacerbate going forward and evolve. So we have to be vigilant. I think this is the key message. One of the key messages from this discussion is that we cannot be static. The response has to be agile and has to be recalibrated on a regular basis based on available information, data, and development. So that's something that we've learned today from both of you. Thank you very much. And I also think that the public health crisis has led, we can see, to economic consequences, and down the road it will lead to political implications. So for the next forum, to our viewers, we will do something about Thai politics during and after COVID. We'll probably skip next week. We'll do it a week after. So please join me. Normally in person, Dr. Kertesz, Dr. Kirida, in person, you would be hearing a crowded room applauding your remarks, your time, your effort, your expertise, but we will do it virtually. Thank you very much for joining us, and also to our viewers, thank you very much for joining us. Thank you. สวัสดีครับ
Thank you all.